Hey everyone, it's Anastasia, Anastasia's Hump Day Happenings. Today I'm going to share with you 10 symptoms, 6 risks for oral cancer because April is Oral Cancer Awareness Month. Now I've been on YouTube since 2009 and I cannot tell you how many videos I've shared with you regarding the risk factors for oral cancer. And as far as we've come along, we still are sadly at a 5-year 50-50 chance of survival. So if I can give you the symptoms and we can understand the risks, it can empower you, the consumer, our patients, to ask questions of your dentist, your hygienist, your general physician, and on and on. Because really it is about getting this early. Stage 1, stage 2, we can treat it. Stage 3, stage 4, it's gonna be a battle for you. So let's get started. All right, 10 symptoms of oral cancer. Number 1, a swelling, a lump or a bump. And it can be a rough patch, or some people describe it as almost like a crusty sensation, especially if it's on your lips. What I'd like to share with you is anywhere that soft tissues, and squamous cells are gonna be in your soft tissue or in your saliva glands. It's not gonna be on your tooth. So if you think about this, you cannot get tooth on the tooth anatomy, your enamel, the root surface of your tooth. So if you feel anything else that is a lump or a bump on your tongue, floor of your mouth, your palate, your soft palate, pay attention to that, because if that doesn't go away in 2 weeks, you've got to make a health and wellness visit with your dentist and your hygienist. Number 2, red areas, white areas. They could be really small, almost like a freckly, speckly mix, or it could be bigger, looking like an ulcer, okay? So if they're mixed, red, white or red, doesn't go away in 2 weeks, get it checked out. Number 3, unexplained bleeding. And this can happen at any time. And I'm not talking if you're not flossing, that's not it. You would know when something isn't right. Okay, so that was number 3. Number 4, unexplained numbness or tenderness. It's gonna be in your face, your jaw, maybe even your throat. Pay attention. Our bodies are telling us something. We just have to pay attention. And I'll say this, to do your own exam, really like squeeze, palpate the inner part of your lips over on top, because a good colleague and dear friend of mine, Debbie Z, has done thousands of oral cancer screenings. And what I can tell you is oral cancer, if you're looking for or feeling for a lump, it can be felt like a small grain of rice. That's how small it is. So really you gotta palpate your tongue, underneath your tongue, the sides, up and around your lips, and share what you find with your dentist, your hygienist, or even your physician. Number 5, a persistent sore, or have you ever felt something in the back of your throat and you just feel like you can't cough it up? And it's not postnasal drip this time of year, because you would think normally postnasal drip. It's not that. It's like a persistent, like a nagging in the back of your throat, or a sore that just doesn't go away. Number 6, difficulty in swallowing, difficulty in speaking, and difficulty moving your tongue. That's where the palpation of your tongue comes along. It can happen on the side. If it's HPV related, which we'll talk about that, it's gonna be on the base of your tongue. Feel underneath your tongue, so check that out. All right, number 7, an earache. That is a symptom. Your dental professional should be discussing this with you, but you should definitely know that an earache can be a symptom of oral cancer. Number 8, a change in your voice. So if you have a sore throat or hoarseness, and sometimes I know that can sound a little sassy, but after 2 weeks and it's still happening, not so sassy. You really want to make sure you get that checked out. Number 9, a change in either the way your dentures fit, your partials fit. What if you're going through Invisalign, or you've had braces and you have the removable retainer? That may not fit over a swelling that you've never had, or a lump that you've never had before. Maybe a night guard, a bite guard, something like that. Really pay attention to, does it fit the same way? And then number 10, unexplained weight loss. All right, so let's go to the risk factors. There are 6 of them. Number 1, smoking. Cigarettes, cigars, pipes, tobacco-free, yes, I'm talking snuff. E-cigs will not contribute to oral cancer, but they have been linked to wheezing and impacting or impairment of lung function. That's not oral cancer though, so I cannot include that. All right, number 2, HPV. I encourage you, have a discussion with your kids. HPV is a sexually transmitted disease. Please get vaccinated for it, or be aware of your lifestyle. All right, number 3, heavy alcohol use. Y'all know what I'm talking about here. Number 4, weakened immune system. If your immune system is weak, that is the perfect time for HPV that can lie dormant to say, hey, I'm just gonna take up residence here and cause you some havoc, okay? It's like mayhem, but think of it as HPV is mayhem for oral cancer that could be potentially life-threatening to you. All right, so number 5, recent studies. marijuana use can higher your risk for oral cancer. And number 6, sun exposure. So ladies, I'm guilty of this too. We all love our lip glosses, our lipsticks, but please, especially when you're here in this, I'm here in Florida, make sure you've got an SPF of minimum of 15 SPF, higher the better. But those are the symptoms, those are the risks, and I'll share this with you. Oral cancer will affect you physically, it'll affect you emotionally, and it will affect you financially. Now, if you've got a question for me, ask it. Please let me know if this video was helpful to you, and otherwise, till next Wednesday, take what you learn and make a difference with it.